You know, while we're all dealing with this pandemic day to day, there is also a big fear about what's to come. Will there be a second wave? BC's Dr. Bonnie Henry, who is the province's Chief Medical Officer of Health, told Matt Galloway, who is the host of The Current today, that our country really must be prepared.
You know, the optimist in me would like to think that maybe it will go away and it'll the virus will mutate and won't become as. But you know what? We've never had a pandemic in recorded history that has not had a second wave. So now's our time to regroup, learn as much as we can over the coming weeks and months, and prepare.
So you just heard experts like Dr. Henry warning this is no time to be complacent. They're concerned about this second wave being a real possibility. Our Chase team has reached Brenda Coleman. She's an infectious disease epidemiologist with the Sinai Health System. Brenda, let's get right to it. How concerned are you? Does this worry hit you?
Yes, it certainly does. As Dr. Henry said, a second wave is almost inevitable, and sometimes we even have a third wave. And I think it's absolutely important that we plan now for that second wave.
Where's the crystal ball, though? Where's the crystal ball saying there will be a second wave or a third wave? I don't want to fear monger, so I want to know what facts there are to back up something that makes us worry.
During the 1918 influenza pandemic, there were 3 waves in several countries, a second wave in almost every country. The 2009 influenza, the swine influenza pandemic that we had just a decade ago, we had a second wave. It's just every time we have a viral respiratory illness pandemic, we've had that in our history. So it's almost inevitable. Not everyone is going to become immune to it during this first wave. So that means that people are susceptible to it as it comes around and starts to spread again down the road.
Here we are in 2020. Are we not smarter medically? We are better, all those things. We're putting restrictions in place. We're lifting things slowly. Are we doing all the right things to perhaps flatten the idea of a second wave?
We are, but then on the other hand, we are human. So we are still people. Unfortunately, people are tired of being isolated and they want to get out and do things. And we are inevitably going to have to open up the economy. We're going to have children go back to school and young adults go back to university and people go back to their offices and their real lives. So as we do that, the possibility of transmission increases.
So what do you suggest then to flatten the curve before we even hit the curve? You know what I mean?
Carry on doing what public health is telling you. Do your physical distancing, wash your hands, cough into your sleeve, do what we're being told to do. If it's almost impossible to totally get rid of the virus. It is going to spread because humans like to be social beings. If everybody could stay away from everyone else, it would go away, It would just it would be gone. If we could do that for 3 weeks straight and not see another single human being, we could get rid of it, but that's not how humans operate.
Right. I know some people who would actually kind of like that scenario, but not for the majority of people, myself included. We are social beings. You brought up some of the history of pandemics having a second, even a third wave. Let me ask you this. What does that second, even third wave do to society? And you mentioned people wanting to be out there and hugging and chatting. What does it do to us mentally?
Well, unfortunately, it puts us back down into the trenches, doesn't it? And having to do the isolation all over again. And people just, they get frustrated a little bit. But on the other hand, for most people, we've been through it once. We lived through it. We're all, we're going to get out the other side of it. So I think they actually see that that's going to happen.
There is also the idea of testing, preventive measures such as that. How critical will testing be in all of this, in the scenarios that perhaps are yet to unfold?
So testing is only part of the solution. We have to do the public health things to make sure that we're not spreading it around, but we do have to test so that we know who's infected, so we can do the contact tracing to find out who they got it from, right? This disease just doesn't come out of thin air. You're getting it from another person.
Yeah, I just
So
did an interview about that,
tracing
though.
is vital.
I just did an interview about that, Brenda, regarding, you know, public health versus privacy concerns of contact tracing. It's a fine balance, right? If it is even balanceable.
If it's balanceable, but I'm sorry, but in a pandemic situation, I'm afraid that the community good, the social good, it trumps privacy.
Okay, final question for you. What else can you suggest people do at home in their daily lives as they head back to work, to the playgrounds, to the daycares in some provinces to mitigate a second wave?
Stay home if you are sick. I think that is the number one thing. If you even think that you might have it, stay home. Don't expose other people to your possible illness. I think that's the most important thing we can do for one another.
You know what? It's a good point. Think of others before you think of yourself, right?
Exactly, exactly.
I want to thank you, Brenda, for your thoughts today.
Thank you, and stay safe.
You too, stay healthy. Brenda Coleman, an infectious disease epidemiologist and an assistant professor at the University of Toronto.